When a virus enters your body, the virus attaches to your cells and injects its genetic material into them. This is a set of instructions that tells your cells how to build copies of the virus. As your infected cell makes copies of the virus, these virus copies can now infect more of your healthy cells and spread in your body. This is when you start to feel sick and your immune system begins to work. Your immune system recognizes when foreign viruses have entered your body and works to build a defense against them. When your immune cells encounter a new virus, they build antibodies that recognize and attach to that specific virus. Once the antibodies attach to the virus cells in your body, your immune system knows which cells to target for destruction. This way, the virus stops spreading. Now that your body knows how to make an antibody to fight the virus, it stores the instructions in memory cells of the immune system. This way, if we are infected with the virus again, our body can quickly recognize the virus, and it can produce antibodies that will destroy it.
How does the COVID-19 vaccine work? Well, all living things, even viruses, are made of proteins. And all living things, including viruses, carry the instructions to build those proteins. These instructions are called mRNA. The COVID-19 virus is covered in spike proteins. And these proteins help this virus to enter our cells. The virus also carries the instructions to build those proteins, again called mRNA. The COVID-19 vaccine contains many small particles, and in each of those particles is the mRNA instructions to build the viral spike protein, and only the viral spike protein. The vaccine will not infect you with the entire COVID-19 virus. This is the main reason why the vaccine is called an mRNA vaccine. When someone gets the vaccine, the particles carrying the mRNA for the viral spike protein will fuse with our healthy body cells. These cells will use the mRNA from the vaccine to help build that viral spike protein, and eventually it will stick out on the surface of some of the body cells. Because some of our body cells are carrying the viral spike protein, an immune cell can now learn to recognize and even memorize the viral spike protein. The immune cells can now make antibodies against the COVID-19 virus. If in the future a vaccinated person gets infected with COVID-19, they already have antibody and the cells that helped memorize the virus in the first place. This gives vaccinated people an immune system better prepared to attack the virus, helping them avoid severe illness and hospitalization.
How did this vaccine get made so quickly?
Vaccines of this kind were being developed long before the COVID-19 pandemic. Because of this, scientists knew how to apply this technology rapidly to the virus and start clinical trials soon after the pandemic began.
Will the COVID-19 vaccine make me sick?
The approved vaccines do not contain the live virus, so they cannot make you sick with COVID-19. Because the vaccine is teaching your body how to fight the virus, some people will temporarily develop mild symptoms, including fatigue, achiness, and fever. Many people do not experience any side effects, but for those who do, symptoms will fade in a matter of hours and can be treated with over-the-counter medication.
What about long-term side effects?
With an mRNA vaccine, the ingredients of the vaccine itself are broken down by your immune system. The only thing that remains in your body after the vaccine is your own immune defenses against the virus. Because of this, there is no evidence to suggest there will be any long-term side effects from the vaccine.
If I already had COVID-19, do I need the vaccine?
Yes, it is recommended that you get vaccinated even if you had a positive test for COVID-19. Your antibody response can weaken over time, and getting the vaccine will jumpstart your immune system.
Once I'm vaccinated, can I stop wearing a mask and social distancing?
Even once you're vaccinated, it is essential to follow all current public health guidelines to protect yourself and others from COVID-19. With the vaccine, you are protected from serious illness from COVID-19, but there is the potential that you could still contract and spread the virus.
Will I be required to get the vaccine?
No one will require you to get the vaccine, but it is highly recommended by the CDC as a way to protect you and others from COVID-19 illness. We need over 70% of people to get vaccinated so they can develop antibodies for COVID-19. This will help to prevent community spread and end the pandemic.
How much will the COVID-19 vaccine cost?
The COVID-19 vaccine will be provided at no cost to you, regardless of your income, insurance, or citizenship status.
COVID-19 has spread around the globe, and it's important to stop the virus from spreading to your community.
As said before, immunizations or vaccines protect us from viruses and diseases. They also stop the spread of these viruses and diseases in the community. The more people who are vaccinated, the less the virus will spread because it has less people to infect. However, some people cannot get vaccinated because they may be too young or have vulnerable immune systems. To break it down, when no one is vaccinated, the contagious virus spreads in the community very quickly. When only a few people are vaccinated, the contagious virus can still spread through the community to those who are not vaccinated. But when most of the community gets vaccinated, very few community members will get sick because the virus has very few people to spread to.
So when will it be your turn to get the vaccine? Washington's Department of Health has currently released this phase guide. Phase Finder is an online questionnaire released by the Department of Health. To access this tool, visit the website findyourphasewa.org. If you've decided to get the vaccine, it's important you make an appointment to get the first dose. Navigating all the online resources can be difficult. Don't forget your primary care provider is another great resource. Here are a few helpful websites for more information regarding the COVID vaccine and how and where to get it.